friends, Dr. Richa Sharma this side. So I am an fertility and IVF consultant, and today in this video we will give you information. I think awareness is the key, as I keep on stressing via various medias on various platforms also, and we have launched a podcast also for the patient awareness. And so we are going to discuss, like, while planning pregnancy, what all specialties of doctors you need help or you come across, because I feel that many patients other than who are in metros or who already have undergone treatment, they are not even aware like what is the difference between various specialties. So when you plan pregnancy, obviously everybody wants that you should have natural, but not every couple is fortunate enough to have it natural. Some have difficulties. So obviously your first point of doctor, first point of contact is a gynecologist. So gynecologist is a doctor, is a specialist who deals with the female problems basically, like gynae problems, any infection, any general gynec illness, periods problem, you can say in layman terms, or you are having any difficulty in pregnancy. So obviously they will start with the basic workup, provided they have the awareness like how to investigate an infertile couple, and they will give you the basic information. But obviously other than that there are obstetrician. So obstetrician and gynecologist, they are combined basically, it's one specialty only. So obstetrician means that when the patient gets pregnant, after that the pregnancy is taken care by the doctor who deals with the pregnant patients, that is obstetrician. They will do the normal deliveries, cesarean section, MTP, and other such things. So other than that, then you come in contact with, if suppose you get pregnant naturally or with the simple measure, then obviously you will continue with the gynec and obstetrician. And in case you have difficulty, then you should reach the infertility specialist or fertility consultant, IVF specialist. These are the various terms which vary as per the nation, as per the country or place, or as per whichever awareness people have. So these are the doctors who actually deal with the couple. So it is not only fixed to the female. So they will investigate what could be the reasons of infertility, female factor or any male factor. So they accordingly they will go for the hierarchy of treatment, that is the stepwise treatment is planned. So as I had explained in previous videos also, stepwise treatment that involves like timed intercourse with simple medicines, or it can be IUI, that is intrauterine insemination, or it can be IVF, that is in vitro fertilization, what we call as test tube baby also. So this is how we proceed. And obviously other than that there are third party reproduction, that is donor egg, donor sperm, and the surrogacy. Obviously lot of law changes, legal aspects are coming, so you should be aware of that, because if you are not aware you cannot blame the others if you get trapped in something. So obviously as awareness is important, and as patient as doctor we both should be aware, because daily laws are changing, and bills are being proposed, and they may get passed, and there will be a lot of changes. And then after that, other than the IVF specialist, there is other we have the lab uh, embryologist, lab directors, you must have heard. So they are embryologists, they are technical people. They further of two types, that is andrologist and the embryologist. So andrology person, they deal with the semen samples. Suppose if you have the semen analysis which is to be done, so that will be basically done by andrologist. So in many hospitals you will see they will have separate andrology lab. And then comes the role of the embryologist. So embryologist means the person, scientist, or those who have scientific background. Even some doctors are opting for that profession, and that depends on the basic qualification. As such, to be frank, till the bill comes, no criteria fixed. So many are working as embryologists. Their aim is to see for the lab part, that is they will form the embryos during the IVF process, they will process the semen sample, they will help you in getting the sperms after the tissue is extracted from the testes, like in azoospermic patient I had mentioned. So other than that, then the third thing is third specialty, rather super specialties of the urologist. So many patients are not aware that what role urologist has. So urologist basically they are super specialist. After general surgery, they opt for that subject, and they deal with the male infertility, especially the high-end types. Suppose if any surgeries are there, varicocele surgery, any obstruction is there in the testis, so or any correlated inguinal hernia, any cyst formation is there, so they deal with that. Other than that, there is a technique called microtessy, like I mentioned in my article also, and in one video also I had mentioned. So that microtessy also is preferably done by the urologist, because they have expertise in that. So it is better that we should always have a team approach and the multi specialty approach, because ultimately aim is that to be exact and to be more precise in whatever we do. Obviously we cannot commit 100%, nobody is god. We can try, but whatever we try, it should be ethical, transparent, and should be in a genuine way, and should be done by the person who is authorized also. Like doing surgery doesn't mean that anybody will take knife and starting doing surgery. So obviously you should check all these things. Other than that, we often come across that patients may suffer from endocrinology problems, like thyroid is often I see deranged in females, and males also, when we investigate for the azoospermia, they also may have. So we need the assistance of the endocrinologist also. So these are the main doctors which we generally take the help. Other than that, there can be additional requirements, like we have cancer patients, then in that case we need the help of the oncologist. So I think as doctor, as patient, we should be aware, like what are the various specialties which exist and which is the right doctor, because one doctor cannot deal everything. Everybody has a specialty and super specialty, they have been expertise in that. So it is always better to reach for the person who has the expertise. I hope this informative video will be beneficial to you, so that you should not get confused when anything is advised, and even if it is not advised, at least you should have the awareness. I hope to see you again with another video. Thank you. Have a good day. Bye.